Peace. Hi, it's Heart Love. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Neville Riley. So, thank you for being here. Appreciate you all reading books. Love to the book lovers community. Love to all my friends, family, and mods. We're here. All right. So we pick up at page 30. Electrophysiology. The concentration of sodium and potassium ions is extremely important to the function of the myocardial muscle cell, the resting myocardial cell has a lesser concentration of sodium ions inside the cell than outside, and a higher concentration of potassium ions inside the cell with respect to the outside. Figure 2.2. The primary cause of this distribution of ions is the active removal of sodium ions from the cell, a metabolic process referred to as the sodium pump. Potassium ions migrate into the cell in an attempt to minimize the imbalance in intracellular electric charge. The final result of this distribution of sodium and potassium ions is still a net negative charge inside the cell with respect to the outside. This phenomenon can be measured and is termed the negative resting membrane potential of the cell. Here is figure 2.2. Has A, B, C, and D, and it shows the resting state, the depolarization, repolarization, and resting state. And then I'll read underneath. Hi, it's Heart Love. Welcome. Thank you for reading books with us. This is Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. So that's figure 2.2. Hi, it's Heart Love. Thank you for being here and reading books with us. Okay, so it says figure 2.2. Schematic diagram of the electrophysiology of a single myocardial cell, depicting both electrical activity and the electrolytic cellular environment. Note, the horizontal axis represents time. A. Shows the resting state of repolarization, minus 90 millivolt. Intracellular state is primarily due to sodium, Na positive, and potassium, K positive. Ion distribution, see text. Depolarization, B, occurs in response to appropriate stimulus. Intracellular state becomes positive in relation to extracellular environment caused by ion changes. Repolarization, C, occurs as ionic distribution returns to pre-depolarization state. And D, indicates the resting state present. Cell is capable of repeating the process. So we're on page 32. Thank you for all being here. Hi, it's Heart Love. Welcome. Live from the light in LA. We're reading this masterful book. When the cell membrane is stimulated, sodium ions enter at a faster rate than potassium ions leave. This results in a temporary net positive intracellular charge with respect to the outside of the cell. This process of changing the intracellular electric charge from negative to positive is called cellular depolarization. After a period of time, the sodium ions are once again removed from inside the cell, and the initial sodium and potassium relationships are restored. This process of changing from a positive intracellular charge to a negative one is called cellular repolarization. If a sensing electrode is placed inside a cardiac muscle cell and compared with a reference electrode just outside the cell membrane, a measure of the electric charge across the cell membrane can be obtained. In this manner, the process of depolarization and repolarization can be measured in terms of an electrical voltage, or millivolts. Such a measurement is illustrated in Figure 2.3. A resting membrane potential of a negative 90 millivolts is rapidly changed to a slightly positive charge of 20 millivolts during the process of depolarization. In order for a myocardial cell to respond maximally when stimulated, it must have a negative resting membrane potential of negative 80 to negative 90 millivolts. Repolarization takes a longer time than depolarization and can be separated into two components: the absolute and the relative refractory periods. The absolute refractory period is the time in which effective depolarization cannot occur, no matter how great the stimulus. The relative refractory period is when a greater than normal stimulus may cause depolarization. However, the cellular response is slower than usual. The normal myocardial contractile cells remain at their resting membrane potential until stimulated by an adjacent cell. The baseline resting membrane potential is in specialized myocardial conducting cells does not remain stable. The baseline rises slowly, slow diastolic depolarization, and at a point called a threshold potential. The process of rapid depolarization occurs. The cell is then repolarized in a manner similar to the normal myocardial muscle cell. This process, in which the cell undergoes spontaneous depolarization, is defined as auto- automaticity, the time interval required for the process of spontaneous depolarization and subsequent repolarization is known as the latency interval. The shorter the latency interval, the greater the frequency with which the specialized myocardial cell depolarizes. I'll show you. Here's 2, 3. Okay. And it has A, B, and C. Welcome. Thank you so much. Thank you. Yes, we are the truth. This is the corner of YouTube where we read books and learn from masters. Thank you so much for being here. This is a masterful book that we're reading this time, and we'll be putting the playlist so you can read them all in succession on this channel. Thank you so much. So, Figure 2.3. All right. In the cardiovascular anatomy and physiology, this is chapter 2, foundations of respiratory care. Okay, so figure 2.3, A, B, and C of the graph. We are reading Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. This is the second edition. All right, so it says Figure 2.3. Schematic representation of myocardial cell depolarization and repolarization patterns. The horizontal axis represents time. ARP is absolute refractory period. RRP is relative refractory period. RMP is resting membrane potential. S is point of cellular stimulus. TP is threshold potential. A. Stimulation during RMP results in normal depolarization and repolarization pattern. B. Stimulation during ARP results in absence of effective cellular response. C. Stimulation during RRP results in a cellular response requiring a longer time period for both depolarization and repolarization. The cells in the SA node normally have the shortest latency interval and, therefore, become the normal pacemaker of the heart. Any specialized myocardial conduction cell in the heart has the potential of becoming a pacemaker and sometimes, under abnormal circumstances, will function in that manner. Numerous factors determine the rate of the automatic cycle. Among these are 1. The level of the resting membrane potential. 2. The threshold potential. 3. The time course of repolarization. Numerous pathophysiologic factors affect these variables, e.g., changes in temperature, pH, hypercarbia, hypoxia, ischemia, and stretch on the specialized tissues within the heart itself. If a sensing electrode is placed on one end of the heart muscle cell at rest, and an indifferent reference electrode is placed near the other side of the cell, zero potential will be recorded. When one end of the muscle is stimulated, a wave of depolarization will travel through the muscle cell and cause a deflection on the monitor, figure 2.4. By convention, a deflection above the baseline is considered positive, and a deflection below the baseline is considered negative. A wave of depolarization that is traveling toward the sensing electrode would cause a positive deflection, whereas a wave of depolarization going away from the sensing electrode would cause a negative deflection. If a wave of depolarization initially moves toward the sensing electrode and then away from the sensing electrode, it will create a positive followed by a negative deflection. This is termed this is termed a biphasic deflection. Repolarization moving toward the sensing electrode will cause a negative deflection, whereas a wave of repolarization moving away from the sensing electrode will cause a positive deflection. Here's figure 2.4 that was just mentioned, that above paragraph. Okay, it has A, B, C, and D, and it's a schematic representation of the characteristics of the electrical response monitor. Okay, so here we go. I told you it's super deep, man. We're going all the way in with this self knowledge, right? The self knowledge. Master ourselves. Love thyself. Okay, so it says Figure 2.4 schematic representation of characteristic electrical response monitored by an externally applied sensing electrode S and indifferent electrode I. Electrical potential differences between the two electrodes are graphically depicted as positive upward deflections and negative downward deflections. The shaded area represents a wave of depolarization. In a wave of depolarization moving toward the sensing electrode produces a positive deflection on the ECG recording device. In B and C, the depolarization waves moves away from the sensing electrode, producing a negative deflection on the ECG recording device. Complete depolarization. And D results in a zero potential difference between the electrodes, thus the ECG recording device shows a zero reading. All right. The ECG. Thank you so much for the likes and subs. Highest heart love. We're pushing towards 500. Just reading books. In this corner of YouTube, we read books and learn from masters. Thank you so much. Reading clinical application of respiratory care. Things that we can help all new people with, and breathing techniques and learning about mastering ourselves. That's what this channel is here for. I'm Master Uriel Riley, Master Fitness Trainer by trade, and your healing specialist. Thank you so much for being here. So, ECG, the ECG, standard deflections in the electric phases of the cardiac cycles are grouped in four categories. 1. Ventricular depolarization. 2. Ventricular repolarization. 3. Atrial depolarization. 4. Atrial repolarization. Thank you so much. Thank you, thank you, thank you. Yes, I am. Thank you so much for being here. Yeah, this is really deep. Thank you so much. The process of atrial repolarization is usually not seen. It occurs simultaneously with the ventricular depolarization, as depicted in Figure 2.5. The P wave is a representation of atrial depolarization. The QRS complex characterizes the ventricular depolarization. By definition, the Q wave is the first negative deflection, the R wave is the first positive deflection, and the S wave is the second negative deflection. If a second positive deflection is present, it is called the R prime wave. It should be noted that every QRS complex does not necessarily have every individual deflection within the complex. The T wave is a reflection of ventricular repolarization. The electrocardiographic deflections are recorded on a paper that is moving at a rate of 25 millimeters per second. The large divisions on the paper would represent zero point 0.2 seconds, and each small division would then represent zero point 0.04 seconds. See Figure 2.5. This makes it possible to look at the relationships of the electric phenomena with respect to time. The PR interval includes both the P wave, atrial depolarization, and the PR segment. The ST interval includes the ST segment and the T wave. Yes. These are the two most common intervals used in clinical electrocardiology. It must be appreciated that the electric phenomenon recorded on the standard electrocardiogram represents the net summation of millions of myocardial fibers and their electric activity. It must be realized that the electric activity of the heart is a related but separate entity from heart mechanics, which is evaluated by blood pressure pulse and heart sounds. The first heart sound, closure of the atrioventricular valves, follows the electric QRS complex, and the second heart sound, closures of the pulmonic and aortic valves, follows the T wave, figure 5. Since the electrocardiogram reflects only the electric activity of the heart, it must not be used as a sole assessment of the mechanical activity of the heart. Here's wonderful figure 2-5. Thank you so much for reading books with us. Eyes, heart, love. Thank you so much. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Second edition. So it says, Figure 2-5. Normal ECG pattern on standard ECG paper is depicted. Note, each large square represents zero point 0.2 second of the horizontal axis. Each small square represents zero point 0.04 second. See text for a description of normal ECG pattern. The time relationships between electrical activity, ECG pattern, and the mechanical activity, heart sounds, are depicted. Sound 1 S is the result of the atrioventricular valve closures. Sound 2 is the result of the pulmonic and aortic valve closures. Here we go. We'll do this last part and we'll reconvene. We'll pause here. All right, page 37. Thank you so much for being here. This is beautiful. It's heart love. The peaceful part of YouTube, where we read books and learn from masters. I'm so honored to be here with you and read to you, especially this valuable information, self knowledge. Thank you so much. Peace be. Highest heart love. Oh my goodness. Can you believe this book we're reading is just like, wow. It's so, oh, thank you so much. Highest heart love. Okay, we're just finishing up this. We'll read this page and then this section, I should say. The ECG monitor. Thank you so much. My mods are in the building. Hi, it's heart love. In the field of respiratory care, the major use of the electrocardiogram is for continuous monitoring of heart rate and abnormal rhythms. The clinician involved in respiratory care must have a thorough knowledge of the use of the electrocardiographic monitor. It is strongly recommended that all respiratory care clinicians seek as much knowledge as possible in the field of the electrocardiography. However, In this text, only the basics necessary for understanding the electrocardiographic monitor and will be discussed. Figure 2.6 illustrates sensing electrodes placed on the right arm and left leg with an indifferent electrode placed on the right leg. The interrelationship of these leads comprises the standard leads of the electrocardiogram. Einthoven, Einthoven's triangle. Lead 1. Hold on. Here's 2.6. We are reading from Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Thank you so much. All right. So, what it's showing, it says the right is negative, the left is positive. Lead 1 from the wrist to the forearm, and lead 2 from the forearm to the left knee, and lead 3 is from the left wrist to that left knee. And it shows on the negative shoulder and the IE. It says figure 2.6 standard limb leads of the electrocardiogram. IE is the indifferent electrode. Insert demonstrates the simplified ECG monitoring used in acutely ill patients. These chest leads may be used in various positions to accomplish continuous ECG monitoring. Lead 1 is frequently the standard ECG monitor lead, although any ECG lead is usable. In the clinical setting, the sensing electrodes are placed on the chest, since monitoring of the heart rate and rhythm is the primary requisite in respiratory care. Frequently, in acutely ill patients, the leads are placed in appropriate chest positions to monitor specific myocardial rate and rhythm abnormalities. And that's where we'll pause. Thank you so much. Page 38 of Clinical Application of Respiratory Care. I'm your moderator and narrator, Uriel Riley. Thank you so much. Appreciate you. Highest heart love. I hope you're having a beautiful summer. We are almost in August. Love water to you all. Thank you so much. Thank you for allowing us to master ourselves. Just be in peace. Thank you so much for this peace. Mm. What a summer. Highest heart love. Thank you so much. Much appreciation. I will see you soon, okay? Thank you so much. Amen. I'm in winter, beautiful. Oh, yay! Well, sending love to you, V. Awesome. Oh, sending love to you, V. In winter. I love winter too. Yeah, live from LA. So, I will see you soon. I love you. Yes, in Australia. Yay, down under. Oh my goodness. Oh, awesome. Thank you so much. Oh my goodness. I have one of my good friends there, Nicole. Love to Nicole. She used to sing I Love You with us too. We are shaking it up in the world, right? We did it. I love you. I'll see you soon, okay? Love to everyone in Australia from LA. Peace, peace.